types of memory problems that some can be cured and others that can be treated as well. The key is to recognize the problem, get a screening, and act on that as well, my friend. And we welcome to our program today Jennifer Jones with Erlanger North Senior Program.
Yeah, it's good to be back.
Welcome to our program. Thank you so much. What is the memory screening? What happens during it?
Well, I do several a year, and often people will come to one and maybe come several months later and get screened again. But what we're looking for is to see what kind of memory problems are presenting. I'll ask them, you know, are you concerned that your memory's been changing lately? What's been going on? And we try to figure those kind of things out. And then I try to identify, is there a possibility that this is actually dementia that's happening, like Alzheimer's? Or is it a normal, you know, more of a normal memory problem that's happening, some more normal memory loss? And we also kind of discuss other issues that may be creating memory problems, medical issues, and often depression. Even depression will cloud that memory, and they start having issues with recall.
Does a person who starts out with dementia, is that a sign of going on to Alzheimer's?
Could be.
Yes and no.
Yes and no. There are so many causes of dementia out there. Two common ones that I actually deal with. One is Alzheimer's, which is an actual type of dementia, and it's hereditary, and age, of course, is a huge risk factor for that. And then the other one is vascular dementia, and that's where people have strokes. They may have a lot of medical issues that, you know, prevent the oxygen from getting to the brain and feeding it like it should. But those are definitely the two most common causes I see.
What kind of services does Erlanger provide for this senior program?
Okay. It's a specialty service, you know, so we have specialty doctors. We have a memory psychiatrist. His name is Dr. Larry Keene. His specialty is with the memory services. We have patient services. When the deterioration of the memory gets bad enough, or the dementia gets bad enough, then they start having behavioral issues that present, or maybe even personality changes. So when this occurs, a lot of times we have those inpatient services that are appropriate to get that kind of more manageable. We also have an outpatient office that treats memory issues and behavioral issues. And then we do a lot in the community. In the community, we try to do a lot of these memory screenings and kind of do some early screening, identify it. We do things working with different police departments, teaching them how to deal with dementia and some of the challenging behaviors that kind of surround the issue.
So who should attend? Is this one of those things where anybody the things you've mentioned?
The community, you're talking about for the memory screening, I would say it's definitely for people in the community. Typically our audience is usually age 60 and above, but I actually get some individuals that will come in their 30s and tell me, I don't know, I'm having memory changes, something's different. Quite often that's where I find the more depression issues. But anybody that's concerned with their memory, it's important because you can get that baseline test. You can come back and compare scores later, or, you know, go and see your doctor later and compare those scores and see if there's any, I guess, moving forward in that process. Yeah.
Now, this memory screening will be at Erlanger North Thursday, February 27th, from 9 to 11 a.m. And you need to register, so you can contact those or call. Same difference. 423-778-5465. That's 778-5465. Or you can also go online. There's lots of information always available from folks at Erlanger.
And also always know the Alzheimer's Association is out there. We work hand in hand with them, and they are a great resource for this community.
Good deal. Thank you. Pleasure to have you with us today. It's amazing how something as small as a peppercorn has influenced the entire world. Let's join Howard in the Mr. Food Test Kitchen just to see how little those things are and how they cook up a delicious cracked peppercorn pork.